Acetic acid solution, NaN, is used to treat outer ear infections, also known as external otitis. It works by stopping the growth of bacteria and fungus, which in turn reduces pain and swelling in the ear. The wetness in the ear canal can promote the growth of bacteria and fungus, so this medication helps to dry out the ear canal, which aids in curing the infection. This solution may also contain drying ingredients such as glycerin or alcohol to further assist in the treatment. It is important to use this medication as directed by your doctor and to follow their recommended dosage and timing for the best results. When using this medication, it's important to follow your doctor's directions. Typically, you will need to use it in the affected ears 3 to 4 times a day. Make sure to only use it in the ear and avoid getting it in your eyes, swallowing, injecting, or inhaling it. Before using the medication, clean the ear canal as directed and wash your hands. To ensure the right amount of medication is given, and to avoid touching the ear with the dropper, have someone else insert the drops if possible. Hold the container in your hand for a few minutes to warm it and lower the risk of dizziness. Remember not to touch the dropper tip or let it touch your ear or any other surface. Lie on your side or tilt the affected ear upward, then hold the dropper directly over the ear and place the prescribed number of drops into the ear canal. Keep the head tilted for about 2 minutes, or insert a piece of cotton if directed by your doctor. Repeat for the other ear if needed and replace the cap after use. The dosage will depend on your medical condition and response to treatment. Use this medication regularly at the same times each day to get the most benefit from it. Even if symptoms disappear, continue using the medication for the full time prescribed. If your ear symptoms persist, worsen, or return after stopping the medication, be sure to inform your doctor. Avoid getting the medication in your eyes, but if it happens, rinse the eye with tap water for at least 15 minutes and contact your doctor if the irritation persists or your vision is affected. When using acetic acid solution, NaN, in your ears, you may feel a temporary stinging or burning sensation. If this continues or gets worse, it's important to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. If you do experience any serious side effects, such as increased redness, swelling, or pain in or around the ears, it's important to contact your doctor immediately. In rare cases, a serious allergic reaction may occur. Seek medical help right away if you notice symptoms such as rash, itching, swelling, especially in the ear, face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, be sure to contact your doctor or pharmacist for guidance. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using acetic acid solution, NaN-, it's important to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions or other issues, so it's best to discuss this with your pharmacist for more information. Additionally, be sure to share your medical history with your doctor or pharmacist before using this medication. If you are planning to have surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's recommended to use this medication only when clearly needed. While the risks are likely low, it's best to have a discussion with your doctor about the use of this medication during pregnancy. It is not known whether this medication passes into breast milk, so it's important to consult your doctor before breastfeeding while using acetic acid solution, NaN-. Remember to always follow your doctor's recommendations and guidelines for the best timing and dosage for this medication. When using acetic acid solution, NaN-, it's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. To ensure safety, keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help in avoiding unwanted complications and ensuring the effectiveness of your treatment. If someone accidentally takes too much of this medication by mouth, it is highly unlikely to cause serious harm. However, if the person experiences severe symptoms such as losing consciousness or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center for assistance. It's important to not share this medication with others. This medication has been prescribed specifically for your current ear condition, so don't use it for another ear problem unless your doctor tells you to. In some cases, a different medication may be needed. For certain ear problems, it's crucial to keep the affected ear clean and dry. Try to avoid getting the affected ear wet during bathing, and refrain from swimming unless your doctor advises otherwise. Be sure to consult with your doctor for more information on how to care for your ear. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at your regular time. Don't take a double dose to make up for the missed one. It is important to store acetic acid solution, (NaN), at room temperature and keep it away from children and pets. Do not flush the medication down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. It is best to consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.